If you don't want to be recorded, you can turn off your camera or change your name. And well, for the agenda today, first of all, I'm going to make a short introduction about the project. If you have joined already the other three workshops that we've done, you will probably have heard this already. Then I will explain a little bit about the workshops, and we will introduce ourselves. I will give the floor to you so you can introduce yourselves and we can know the background of everyone that is here. And then we will delve into the topic of social inclusion and cooperation and the new professional profile, learning outcomes, and learning contents of it. And we will be discussing a bit these outcomes and these learning contents, so we can have your opinion as well as experts and professionals on the topic. The different workshops that we have had the aim of discussing the skills and knowledge and attitudes of a professional to develop and promote thematic areas, the different workshops we've been having, and we will discuss this proposal so we can take in all your opinions so we can develop this new curriculum. So now, before delving into this workshop and this topic, I would like to, introduce myself. First of all, my name is Clara, I'm a sociologist and I'm working for Edad Dorada, Mensajeros de la Paz in Spain, and I will be hosting the workshop today. And I would like you to introduce yourselves as well so we can know each other and know our different background. First of all, I would like to start with Angel. Please, could you introduce yourself?
Hello, good morning. This is Angel Yahweh from Spain. I am a sociologist as well. I'm working for the Spanish Confederation of Older People organization, that in this case is the applicant organization of the AGE-Friendly Toolkit. So on behalf of my organization, I would like to thank you, all of you, for attending this workshop. And I think that it's an opportunity to exchange views on this important issue that is linked with other issues of for age-friendly cities and communities, and also for creating age-friendly environments. So thank you for joining us, and I hope you will enjoy this workshop. Your contribution will be taken into account when we develop a training curriculum for the new professional profile. Thank you. That's it. Bye.
Thank you very much, Angel. Sara, please. Sara Beccati.
Hello, my name is Sara Beccati. I work for Anziani Non Solo, that is the Italian partner of the project. I'm sociologist too, and I'm engaged in different European projects addressing to elderly people, and that's all.
Okay, welcome, Sara. Thank you. So I'm gonna try and pronounce your names. I'm so sorry in advance if I say them wrong. Dukacin Nishik.
Hi everyone. I'm Dugacin Nishik. I'm coming from Kosovo, representing NGO Suriviz Unit, and we have in Kosovo a program which is called AGE+. It's a regional program. It's to support well-being of and social inclusion of elderly people in Kosovo and Serbia. Thank you very much, and nice to meet you all.
Thank you very much. Welcome. Nice to meet you. Lucia Tillman.
Hi everyone, my name is Lucia. I'm from the Netherlands and I work for Academy, one of the partners in the consortium. At Academy, I'm a project coordinator and researcher, and we focus on developing and promoting age-friendly environments in Europe and the Netherlands.
Thank you very much, Lucia. Welcome. Abdallah Boudaya.
Yeah, good morning, everyone. My name is Abdullah, working at VID Specialized University in Norway. My background is a nurse and public health, and we are providing education for nursing students in a master, bachelor, and PhD level. Thank you.
Thank you very much. Welcome. Daniela Korak?
Good morning, everyone. My name is Daniela, and I'm from Serbia, from Novi Sad Humanitarian Center, which is an NGO, one of the partners on AGE+ project. That project aims to contribute to creation of elderly-friendly communities, age-friendly communities. Thank you.
Thank you very much. Welcome, Daniela. Nilüfer Korkmaz?
Yeah, hello everyone. Good morning. I'm from Turkey. I'm in Akdeniz University in gerontology department. My backgrounds are urban anthropology and landscape architecture. But I'm in gerontology department, so my special focus on aging in workplace and age-friendly environment. And I'm teaching environmental gerontology in my department.
Thank you. Thank you very much. Welcome. Agnieszka Ciesla?
Yes, that's right. My name is Agnieszka. I'm from Warsaw. I work at the Warsaw University of Technology. My background is architecture and urban planning. In my research, I focus on the age friendliness. Thank you.
Thank you very much. Welcome. Ilenia Geno?
Hello, everyone. My name is Ilenia. I work for Age Platform Europe, which is an organization often for people age 50 plus and working at European level in Brussels. We are partner of the AGE-Friendly Toolkit project, and we will be in charge of the final international workshop in November. You will get more details in the coming weeks. And nice to meet you all.
Nice to meet you. Welcome. Georgi Kupik?
Hello, everyone. My name is George. I come from Serbia. I'm working for Tara International Consulting, and my background is in technology and medicine. And we are currently implementing the AGE+ project.
Thank you very much. Welcome. Hedva Binarski?
Hello, everyone. I'm Hedva Binarski-Peretz from Israel. My background is public policy. I'm specifically in public policy, work, family, elder care policies, and specifically of those informal carers who combine work and care, informal care. Currently, I'm the head of two departments in the Israeli Valley College, Department of Political Science and the Department of Public Policy. And I'm a member of the Cost Action Network Age Smartly, as some of you here also are members of this Cost Action. Nice to see you again.
Welcome. Thank you very much. Let's see who else I have here. Fiola Siri Visionit.
Yes, hello. Can you hear me?
Yes, we can hear you.
Okay. I'm Fiola from NGO SIRENE in Kosovo. I'm a psychologist. We are currently working on AGE+ project, and as I said it before, this is a new project for our country, and that's why we are interested in these workshops, to learn new things and to implement here in Kosovo. Nice to meet you all.
Nice to meet you. Thank you very much for joining. Welcome. Alison Bow, Policy and Programs.
Hi, my name is Alison, and I am the head of policy for Active Retirement Ireland, and that is Ireland's largest membership organisation for older people. We promote positive ageing, and we also work on policy to do with aging, all aspects of aging. And my professional background is as a health psychologist.
Thank you very much. Welcome. Joanna?
Hello, everyone. Good morning. My name is Joanna. I'm from Portugal. I'm an architect. I have a small office also in Portugal, and I just started my doctoral studies in the theme of aging in place and architectural design.
Hello, welcome. Thank you very much. Nilufer Korkmaz?
I already.
Oh, I'm sorry. Yeah, sorry. Also here, Anna Irina Lecoux. I don't know. Sorry if I pronounce it.
Hello. I'm sorry for being late. I took a virus in the meanwhile from the kindergarten. So I'm here with the same will to learn new things and to share experiences about researches on seniors. I'm a geographer. I'm working at the Human and Economic Geography Department at the Faculty of Geography, University of Bucharest. Nice to see you all. Thank you.
Nice to meet you. Thank you very much for joining. So I think that's all. If I have forgotten someone or someone hasn't introduced yet, you can do it now, please. Well, I think that's all. Okay, great. So delving into the topic we're going to be talking about today, that is social inclusion and cooperation. Well, the objective is to combat and prevent ageism and social inclusion and the transformation of older adult communities from possible vulnerable groups to strong communities through cooperation. In the workshop, we will be discussing the knowledge, skills, and competencies that a professional needs to promote and facilitate the creation of environments that are socially inclusive places and the promotion of intergenerational cooperation. So first of all, a short introduction about social inclusion and cooperation. According to the World Health Organization, social inclusion refers to the active participation and involvement of older people in the social, cultural, economic, and political life of their communities. It's essential for combating social isolation and loneliness, which are common problems among older people, and particularly those with limited mobility or social networks. It also enables older people to remain connected to their communities and maintain a sense of purpose and dignity in the later years. Meaningful relationships based on intergenerational are indispensable for social integration and cohesion. Then talking about the non-discrimination, on the other hand, it means to ensure that older people are not subjected to unfair treatment or discrimination based on their age, gender, ethnicity, religion, sexual orientation, or any other personal characteristic. And discrimination can lead to exclusion, stigmatization, and reduces access to services and opportunities, which can be negative or have negative consequences for the health and well-being of older people. Talking about the situation in Europe, according to Eurostat, this is the evolution of the percentage of people that is at risk of social exclusion. And the people aged 65 to 74 would be the pink line, and people aged 75 and over would be the green one. We can see there is this tendency to high tendency. And talking about the ciphers or the numbers, we would say that 17.5% of people between 65 and 74 years are at risk of social exclusion, and almost like a bit over 19% of people over 75 years old are at risk of social exclusion. So that's why it's important to develop this curriculum and have these workshops taking place. The new professional profile that we are working on is the training curriculum for the new profile of reference professional for the development of cities and communities friendly to the elderly. the partners of the Toolkit project are working, or we are working on a proposal that is composed of a set of learning outcomes and a set of learning contents. Both of them linked to the WHO domains for age-friendly environments. About the learning outcomes, we are defined as the should know, the understand, and the things that you are able to do at the end of the learning process, which are defined in terms of knowledge, skills, and responsibility or autonomy. In the social inclusion and cooperation team, the project considers that at the end of the learning process, the students will be able to identify different forms of social exclusion and different ways to prevent it and promote social inclusion and cooperation as knowledge, the prevent of social exclusion and enhance respect towards other people, and promote cooperation and participation as the skills, and active listening, person-centered approach, and teamwork and empathy as the attitudes. The learning contents and learning outcomes in a general sense at the end of the learning process would be like the students will be able to describe the different forms of social exclusion in later life, identify the forms of ageism, recognize forms of abuse towards other people, understand the importance of intergenerational solidarity, recognize the different vulnerabilities and vulnerable situations other people can face, target vulnerable groups in communities and spot the degree of frailty and vulnerability, promote more positive images of older people and aging, promote principles of equity, prevent and effectively respond to elder abuse, neglect, and fraud affecting older people, facilitate intergenerational activities and promote social capital and neighborhood cohesion, understand ageism, putting yourself in an older person's shoes, take into account and work with other people since step one as a person-centered approach, understanding the difficulties older people face and demonstrate the positive results of intergenerational activities and the creation of social capital in cohesive neighborhoods. This would be the general learning outcomes of all the curriculum in this sense. Then we have the learning contents are divided in 3 units. The Unit 1 is about combating ageism and social exclusion. Unit 2 is to promote inclusion within neighborhoods. And the Unit 3 is towards strong communities. On Unit 1, we can find 6 different topics we will be talking about. An introduction and background knowledge that is needed for understanding the topic. Combating ageism, promoting a positive image of aging and increasing awareness of aging issues. Combating older people abuse, neglect, and fraud. And case studies, as we have here for every age. That is a life cycle approach project that is developed by the United Nations Population Fund in Asia and the Pacific. And the life cycle approach is very related to intergenerational cooperation as well. And then we have conclusions of the unit. In this unit, the learning outcomes would be understanding ageism and putting yourself in an older person's shoes, understanding the difficulties of older people, identify forms of ageism and recognize forms of abuse towards older people, promote more positive images of older people and aging, and monitor and evaluate as outlined in the WHO report. So within this unit and this learning contents and learning outcomes, I would like you to share with me if you have any comment or you would add something or you think something is more important than other things. And if you know any other case study that we could use in this unit, it would be perfect as well. So you can either talk or you can write it on chat, whatever makes you feel more comfortable. But yeah, I give you the floor for a few minutes so you can share your opinion. Lucia, please.
Yeah, thank you for sharing the learning content for social inclusion or for combating ageism and social exclusion. I think in this unit, it's very we will very well explain ageism and promoting a positive image of aging. But because this learning unit is also about social exclusion, and there also are a lot of other reasons why people can feel excluded from society. So I was thinking maybe in this learning unit, we should also include other ways that people can feel socially excluded, such as socioeconomic background, and maybe someone is from a migration background, which also makes them feel socially excluded, or someone has a really small social network. So I thought maybe that's something that we should still look at to make sure that we tackle the different sources that people have, so that they feel socially excluded, instead of just only focusing on ageism.
Yeah, that's very helpful. Yeah, thank you. Ángel? We can't hear you, Ángel.
Thank you, Clara. I really like your explanation, and I think that the content is very complete. I totally agree with Lucia. I think that it's important to consider other collectives, not only the problem of ageism, that it is a terrible problem. This is the reason for many situations of social exclusion, but we need to mention other situations, as the situation of migrants. Also, gender situation is important too. I think that in this picture we can see two concepts that are important to mention. First is combating ageism, that it is a very illustrative situation, but on the other hand, we can see promoting a positive image. I think that this is the tone that we need to follow. A positive tone is very constructive, and I think we can join other responsibilities in building a new society. So I think that promoting a positive image contributes to combating ageism. This is the way that we should follow. This is one of the most important things, because the image of other people is not good, and we need to give value to other people's contributions to society in different issues. For example, in employment, in unpaid employment, that it is the topic that we will discuss in the next workshop. So I think I really like this idea, and we had the opportunity to talk with people from social services in different municipalities in Spain. Agrees in this concept to give value to positive image, and many materials are also developing in this area. That's it. Thank you.
Thank you very much. See, yes, you're right, and you see as well. I think that adding more perspectives of social exclusion and different, but not just centering on age, I think it's very important as well. So yeah, thank you. Someone else was raising their hand, I think. And Irina, yes, please.
Yes, I'd say just to continue the previous ideas, that maybe intergenerational ties and connections could be also a point that could be evaluated and tackled, just because when talking about different cultural patterns, the social connections between generations might be different from a country to another, and maybe that seniors are much more involved in raising their and helping children, actually taking care of nephews and nieces, maybe. Okay. Thank you.
Thank you. Yeah, that's very helpful as well. Thank you, Anna. You're totally right. Yes, as this is supposed to be to all the countries, and they have different patterns as well. It's interesting to check the differences on relation and the differences of exclusion or inclusion levels in the different countries. Yeah, you're right. Does someone else have something to do or say about this? Do you have any case study that could be helpful for this, or good practice example, or something? You can also share it. No? Okay, so let's continue with the unit 2, promoting social inclusion within neighborhoods. And this unit, we have as well 6 different topics we're going to be talking about. Again, an introduction, explaining the most important things about the topic or some background knowledge that would be needed. Then we have equity between and within neighborhoods, preventing loneliness and isolation, support for carers and families. And then as case study, we have the good practice of promoting social inclusion of elderly through well-being parties by SIPE in the Central Baltic. And then we have the conclusions. Here, the learning outcomes would be to describe the different forms of social exclusion in later life, to promote more positive images of older people and aging, promote principles of equity, take into account and working with older people since step 1, understanding the difficulties older people face, and again, monitor and evaluate as outlined in the report. So, talking about this unit, good practices, case studies, something that we could add, something that has more importance than the other things. Do you have anything to say? Again, you can share it aloud or you can write it on the chat. If you agree with it, if you don't agree with it, whatever would help. Lucia, please, yeah.
Could you maybe explain a little bit more what you mean between equity between and within neighborhoods?
Yeah, sure. So it's basically the equity between, or this social inclusion of everyone within a neighborhood, but also between neighborhoods, because we can tell that not every neighborhood is the same. So maybe also working with neighborhoods that have less opportunities or that have a more complex composition of society, or have or face other difficulties that are not just the aging society. And it's important to have this equity between older, younger people and other senses, not just age. And it's just within the neighborhood and between the neighborhoods.
Okay.
I don't know if I explain it.
Yeah, thank you.
Okay, Agnieszka, please.
Yes, I think that it's good that you want to elaborate more on the what is actually social exclusion, and I think that you can you should mention actually the reasons for this exclusion, and one of the very important is the economic reasons. Because for instance, the Polish seniors, but I don't think that it's not necessarily the case of Poland, are quite poor. And this is the lack of financial resources is also a barrier for social integration, for social inclusion, because they simply cannot afford doing many things as other people. So I think that's also quite important thing.
Yeah, you're totally right. Yeah, it's very important. Thank you. And Irina, please.
Thank you. I think that when discussing inclusion within neighborhoods, I know it's an external factor, but maybe the types of neighborhoods should be discussed as well, geographically, but not necessarily even from the architectural point of view. There are neighborhoods with blocks of flats. I know this example from large cities in Romania, but there are also neighborhoods with houses, individual houses. And I'm not sure where it's easier, actually, the social inclusion. Maybe the proximity of flats makes more vivid the associations of seniors that live in large cities. I can see them sometimes gathering and talking at the first floor of the block where they're living in. But the type of housing is important in neighborhoods, and maybe it's an external factor, but favorizing or maybe imposing some barriers for social inclusion, maybe that should be included as well. Thank you.
Thank you. That's a very interesting point of view, and you're totally right. Yeah, the way the neighborhood is composed, like talking about urbanism or architecture, also can be, as you said, a barrier or a facilitator of these gatherings. So yeah, thank you very much.
Thank you.
Anyone else? If you have examples as well of case studies or good practices, it's also very helpful as well.
I do know of some tools in the Netherlands that are used to help people gain insights in their own social network. So sometimes people don't realize that their social network is pretty limited to only a few people. And I've worked on a tool before that helps people gain insights in who is important for them and how they can improve their own social network. So I can send the website in the chat, but it's all in Dutch. So I hope you understand.
I can try, yeah, with your translators and everything. Yeah, that's very helpful. Thank you, Lucia. Something else? No? Okay, so heading towards Unit 3, there's towards strong communities. We have again an introduction with background or important knowledge that the student would need to know beforehand. Then we have how to target vulnerable groups in communities, then strengthening communities, encouraging interaction that is very related to intergenerational cooperation. And as a case study, we present here Aging Better by Community Fund UK. That is a very complex and big project, but it's very, very helpful. And then we would have conclusions. And the learning outcomes for this would be to understand the importance of intergenerational solidarity, to recognize the different vulnerabilities and vulnerable situations older people can face, to target vulnerable groups in communities, to promote principles of equity, facilitate intergenerational activities, and promote social capital and neighborhood cohesion. Take into account and working with the older people since step 1. Demonstrate the positive results of intergenerational activities and the creation of social capital in cohesive neighborhoods, and again, monitor and evaluate as the report says. So talking about this unit, I think personally it probably is the most important one without taking an importance of the other ones. But I would like to know your opinion and know what you think about it, if we should add something, if something should be highlighted, if you know any other case studies that we need to share. Yes, please, Nilufer.
I just wonder the term vulnerable. You mean minorities, migrants, older adults, something like that, or it's a problem, I think, if we say vulnerable group. What it means? Maybe we can add the others or explain the term. Yeah.
Yeah, I agree. Yeah, no, it's basically any kind of vulnerability that we can see on the elderly or older people collective. Like, I don't know, for example, here in Spain, we have examples of practices in pharmacy shops or I don't know, hospitals that they see or check some vulnerabilities in certain type of people and they can share it. So it's learning how to target these vulnerabilities, but you're right that we should like explain it or be more precise about it because it can lead to confusion. Yeah, thank you. Angel?
Yes, okay. In this slide and related to the learning outcomes, I missed the concept of communication and the social networks. I think that both are important concepts that we should include in these units and learning outcomes, because important to be able to create social networks that facilitate people feel integrated in the community, in the neighborhoods, in the city hall, in the community. So related to isolation and unwanted loneliness, I think that it's very important to talk about volunteering and this kind of networks. And also, for example, you mentioned age-friendly pharmacies, or pharmacies that are working for the interests of the older people in the neighborhoods. This is one concept that we should implement in our training curriculum. So I missed this concept there. Creating networks and co-production, co-creation, social environments to fight against loneliness, social exclusion. That's it.
Yeah, thank you very much. Also, if you know any good practice or case study regarding intergenerational cooperation, it would be super helpful as well. So yes, Lucia?
Yeah, I think Elenia also already said it in the chat, but AGE platform and we as Academy were involved in an Erasmus Plus project that worked on supporting the development of neighborhoods in which older people are connected to each other and in which they can use their talents and strengths. It's in the chat, so I think that could function as a case study in for this learning unit. But what I was also thinking is that in order to strengthen communities, I think professionals should also really be able to collaborate and cooperate with other professionals from a lot of different backgrounds. So I'm not sure if this should be just in this learning unit. I think this is important for all the learning units that we will develop. But I think interprofessional collaboration or interprofessional cooperation is also something that I think we should mention somewhere in the toolkit, because it's not just about making sure that the seniors in a community are connected to each other. It's also important that all the services that are provided in communities communicate with each other, work together, so that the neighborhood or the community or the neighborhood really becomes strong and resilient and age-friendly.
Yes, totally. You're right. Yeah, it's a very important point of view. Yes. Do you have any other comment with this? If you don't agree with something, if you agree with something, you're free to say it as well. If you know any case study, good practice about intergenerational cooperation or how to help or encourage this cooperation between different generations, it would be very helpful as well. But yeah, basically these are the three units that we propose from this point of view. Now more general, talking about the whole topic, social inclusion and cooperation. If you feel like there's some learning units that should be added or some learning outcomes that are missing, or if in general about this topic, you know, a good practice case or any example that could be used, it would be very helpful. So now talking about the general topic, I give you the floor as well if you want to share anything that you find important or relevant to add. You can write it on the chat as well. No, I assume that you agree with everything, and you think everything is okay if no one is saying anything. Okay. So now the next steps that we have is to develop for the development of this professional profile. The development of the definitive learning units is what we are going to be working on now, and the development of an e-learning platform, and then the international validation workshops at the national level. And then we will have the second panel meeting in November 2023. It will be in Belgium. And then we also will be presenting the results at the international level. And thank you very much for joining. I hope it was a bit helpful for you, or you learned even if it's just a little bit. And thank you very much for joining. I encourage you to join to our last workshop that will be on Friday. And yes, this would be everything. This workshop, I think, was quite short, but it's okay. And yeah, thank you very much for joining. That's all for me. If you want to add something or say something, I give you this last opportunity if you want to speak. And if not, yeah, that's all for me. And thank you very much for joining. Angel?
Yes, I just want to say that the next workshop that will be on Friday, the 29th, we will talk about civic engagement and employment. And this occasion, we will have a guest important. We have invited two experts from Eurofound, who will inform us about working aging and the recent researches and findings that they have in this area. And I think that it would be very interesting, and they will complete the part of the training curriculum that we are working on. So don't miss it, and I will look, and I am looking forward to seeing you all on Friday to discuss on this important issue. That's it. Thank you for attending this workshop.